Hello, my name is Emmeline Rubio, former medical office manager and medical assistant in the workman's comp field. Low health literacy was something that I frequented and experienced on a daily basis. Health literacy is the degree into which patients understand basic health information and services needed to make appropriate health decisions. According to the National Assessment of Adult Literacy, 9 out of 10 adults lack the skills needed to manage their health and prevent disease. Low health literacy has been linked to lower health outcomes, frequent emergency room visits, higher mortality rates, causing higher healthcare costs. Health literacy is just not hearing what the healthcare provider is saying, but actually understanding what the provider is saying. Also reading and understanding numbers and navigating through the medical system. Lower health literacy often leads into worse outcomes and higher use of healthcare resources. There are some red flags into identifying low health literacy in patients. The signs are when a patient has a difficulty in filling out registration forms or denies filling them out, decides to take it home to have somebody else fill them out, makes an excuse such as they forgot their eyeglasses at home. There are also patients who cannot explain and or demonstrate how they take their medications, causing a hazard to themselves. So how do we help fix this? How do we help our patients understand his or her medical condition, how to take their medication, and talk about their treatment? I strongly believe when a healthcare provider and their staff help educate our patients, health literacy strongly improves. We help educate our patients by providing clear written instructions and also clear verbal instructions. You would provide things such as pre or post-op instructions, medication instructions, consent forms. We will also help the patient by helping them understand medical terminology. This will come into play especially when you're trying to explain a medication or medication instructions to a patient, explaining or translating the abbreviations as needed. You will also make sure that the channel is a clear communication to where a patient acknowledges and understands what you are saying. You will use layman's terms whenever possible, helping the patient understand better when they know what they are listening to. And of course, providing easy to read formats, such as bulletin points. As you know, low health literacy often is because they don't know how to read. So you will provide visuals for some patients to help them understand better by looking at pictures, instructions using pictures, arrows, to help the patient identify the message. And also help patients with little to no literacy skills. At the end of the day, what we want to do is to reduce the complexity of medical information that is given to the patient and helping them understand better to lower any discrepancy. Also, let patients know to be aware of services that improve quality of care and literacy. At the end of the day, what we want to do is to reduce mortality rates, provide better health care, get more compliance out of patients, which would lead to lower healthcare costs for these patients. And also helping patients understand complex health information could aid in reducing healthcare costs. So how are we going to help patients become more health literate? by educating our patients, providing clear information, and providing clear communication, and using visuals to help the patient understand their health and their care. We must do something now. Thank you very much for joining me.